Glasgow Coma Scale is a measure of. The option says it assesses the level of consciousness, assess the prognosis post-surgery, scoring of wound and trauma, and categorizing the patient's post-operative care. So let's focus on Glasgow Coma Scale. So it is a scale used to assess the patients with head injury, that is the trauma patients. So in case of a trauma, the primary management includes 5 important things. What are they? A, B, C, D and E. So what does this A, B, C, D and E stands for? A stands for airway, B for breathing, C for circulation and D for disability evaluation, and E denotes the exposure of the patient from head to toe in order to assess for any other injuries in the body. Therefore, the primary management is to assess the A, B, C, D, E of the patient. And out of this, the most important one is disability, because this disability evaluation includes the neurologic examination, that is to assess the level of consciousness, and this can be done with the help of Glasgow Coma Scale. Therefore, the level of consciousness of the patient can be assessed by means of Glasgow Coma Scale, and this Glasgow Coma Scale gives specific score to the patient. So this Glasgow Coma Scale, it includes 3 important parameters. They are the eye response, verbal response and motor response of the patient is assessed, and then a score is given to the patient. Now let's discuss one by one. First is the eye response. The eye response is divided into 4 different scores. As the score decreases, the patient's conscious state also decreases. So the highest score, 4, indicates that the patient opens the eye spontaneously. So this is a good sign. Whereas as the score decreases to 3, the patient responds by opening the eyes to voice. And score 2 indicates that the patient opens the eyes only to pain. Whereas the score 1 indicates that there is no eye response at all. And next, it is followed by the verbal response. So verbal response, 5 scores are given. What are they? The score 5 indicates that the patient is appropriate and oriented. So this term oriented, it simply means that the patient is able to recognize who they are, what they are doing or where they are, and they know the time, place, etc. So it simply means that the patient is oriented. Whereas the score 4 indicates that the patient gives or makes a conversation but in a bit disoriented and confused state. And score 3 stands for the response by inappropriate words. That is, the patient is making some random words, but it is not a conversational exchange. They are not responding in response to the question that is asked to them. So they just make some random responses, random words they utter. Whereas score 2 stands for incomprehensible state. Incomprehensible determines that the patient do not utter any words, but they just make some moaning sounds, and that is given the score of 2, that is incomprehensible response, and 1 denotes that there is no response given by the patient. So these are the 5 different scores of verbal response, and the last parameter is to assess for the motor response of the patient. And this includes 6 scores starting from 6. It simply means that the patient obeys to the commands given. And score 5 indicates that the patient is able to localize to the pain. And score 4 indicates that the patient shows a withdrawal response to the pain. And score 3 indicates that the patient shows a flexor response, an abnormal flexor response to painful stimulus. And score 2 indicates the extensor response shown by the patient. And score 1 indicates that there is no motor response elicited by the patient. Therefore, these are the 3 important parameters assessed by means of Glasgow Coma scale, which indicates the level of consciousness of the patient. So, we have to remember it in the same order, that is, first eye response, followed by verbal response, and followed by motor response. It is because to remember it in an easy way, because eye response takes 4 different scores, verbal 5 scores, and motor includes 6 different scores. Therefore, 4, 5, 6, eye, verbal and motor response EVM is assessed. And the total score, or we can say the maximum score that a person can score, is 6 plus 5 plus 4, which is 15. Whereas the minimum score one can get is 3, because the no response, it is no eye response, no verbalization and no motor response, all are indicated by score of 1 each. Therefore, the minimum score is 3. And now to assess the prognosis, that is, if the score is 13 to 15, then it indicates that the patient is suffering from mild head injury or minor injury. If the score is in the range of 9 to 12, then it indicates that the patient is suffering from moderate head injury, and if it is less than 8, that is 3 to 8, then it simply means that the patient is suffering from severe head injury. So these stages or these different scores to assess the prognosis of the head injury is also very important. So, eye response 4 scores, verbal response 5 scores, motor response 6 scores. Overall it is 15 and minimum is 3, and based on this we can assess the level of consciousness of the patient. Therefore, Glasgow Coma scale is a measure of, it assesses the level of consciousness of the patient. Therefore, the right answer here is option 1.